Tonight, 7 News investigates. We've been following a deadly outbreak of COVID-19 at a residential care facility for the intellectually disabled. Just over 150 residents and staff have now been infected there, and DHEC says 4 people have died. A healthcare worker was the first casualty. Tonight, 7 News investigates the Whitten Center outbreak. 13 weeks ago, Maurice Simmons, a healthcare hero, marked himself essential. His mom urged him to stay safe. 3 weeks ago, he texted this selfie to a coworker. Simmons was being admitted with COVID-19. 2 days later, on June 26th, a man many in his community will always remember as Coach Mo took his last breath. He was 41. Simmons' sister doesn't think he had the protection he needed to do his job.
I think it's horrible. I think if you're requiring someone to work, then you should have the proper equipment to keep them, at least try to your best ability to keep them safe.
Simmons worked with intellectually disabled adults at the Whitten Center, site of a COVID-19 outbreak. Staff remember the first employees testing positive back in April, and 7 News spoke to a former employee who says she tested positive in March. So far, 88 employees tested positive, according to the Department of Disabilities and Special Needs, with 57 residents catching COVID-19. So how did nearly 150 people get sick when the governor and state health officials said South Carolina was focused on keeping people safe in group living settings? In the 7 News investigation, more than a dozen Whitten Center current and former staff reached out to me, blaming the spread of the virus on a lack of essential protection and staffing shortages, leaving some working with both positive and negative residents.
We had to fight to be able to wear cloth masks.
As the coronavirus started sweeping the country in March, Amanda Weathers, now a former Whitten Center nurse, says masks were not embraced. Her mom even sounded the alarm to a state senator. Current and former workers shared screen grabs and photos of the mask messaging. In early April, with at least one positive employee already at Whitten, the director emphasized it was voluntary to wear masks. None would be provided. A week later, another note from the director. Workers were given a cloth mask. They were mandated to wear it and wash it daily. In June, not long before Maurice Simmons got sick, staff remember medical-grade N95 masks being distributed to some staff. Workers tell 7 News they were told to re-wear the N95s with COVID patients until the masks wear out. Multiple staff members say personal protective equipment and cleaning supplies were gathered up at the beginning of the pandemic and locked away in the nursing office and supplied sparingly. DHEC investigated and did not cite the Whitten Center for a lack of PPE on June 30th. During the inspection, they noted they had 331 N95 masks on site. Staff say the raincoats they wear as disposable gowns in a COVID-19 residence room are shared shift after shift. One employee said up to 12 people might wear one in a day. And with nearly 90 workers getting the virus, employees tell 7 News staffing levels have been dangerously low. Workers say they've been down to 2 people to cover a unit at times.
I knew that there were 3 that had tested positive, and I had hands-on care with them, so I was exposed.
Despite that COVID-19 exposure, on June 21st, Amanda Weathers says she was presented with what she considered a dangerous and unethical assignment.
They wanted me to go into a building that had trach patients.
205, the building that many staffers tell me houses some of the most vulnerable residents at Whitten Center.
It doesn't matter.
It doesn't matter go in?
Yeah, it doesn't matter. We don't have any other choice.
So because of the low staffing, even though you'd been exposed to COVID, they wanted you to go work with these vulnerable people?
Yes.
Weathers didn't do it. She went home. The next day, she got a coronavirus test, and she was positive.
So I would have exposed all of those consumers I worked with that night.
After recovering, Weathers received this letter saying she was fired for leaving her workstation without authorization. The head of Disabilities and Special Needs says she can't comment on personnel matters.
It was a total of 3 of us. In that unit, it's supposed to be 10, if I'm not mistaken. It's supposed to be 10 staff.
Shamika Harris was fired last week, too. Harris says on June 29th, she was sent to the building at the Whitten Center with residents known for their behavioral challenges. She says the other workers were assigned 2 harder-to-manage individuals that get one-on-one staffing. She says she wound up single-handedly responsible for 12 people.
One of the consumers got out.
After she put everyone to bed, she says he escaped.
It was after 10:30 that he got out took out the chime off and he snuck out the unit. It's of that he left camping and got hit by a car.
So this resident got hit by a car. Harris says thankfully the resident has minor injuries. Do you think it's possible for one person to watch 12 people in a unit like that?
In a high level unit, no ma'am, it's not possible, because of the behaviors themselves. That day, even though I gave him 100%, I still end up failing.
The Department of Disabilities and Special Needs calls their healthcare workers heroes, working double shifts and filling in for sick colleagues. In an email last Wednesday, the state director, Mary Poole, said, "I was at Whitten Center all day yesterday, was properly screened in, wore a mask all day, washed my hands frequently, and maintained social distance from those I met with, and personally laid eyes on the personal protection equipment available, and I concur with DHEC there is no basis for the complaint." We wanted to speak with the director, but she insisted we go to her home or office, and so far has not agreed to the webcam interview we offered repeatedly. This morning, on my third attempt to get some detailed answers about the reuse of PPE, one of her deputies sent us this email response and denies employees wear masks beyond their usefulness. Also from this, it appears they've doubled the supply of N95 masks over the last 2 weeks, and they're also encouraged that staff and 36 residents are recovering from COVID. They also are updating their cleaning protocols. You can read through all the details on WSPA.com. We are posting the entire thing. Keep in mind, DHEC did not give an all clear to the Whitten Center. DHEC did cite both campuses for not logging the temperatures of a healthcare worker and not having the housekeeping infection control plan available. Online, some different allegations made by DHEC, plus an infectious disease specialist weighs in, and you'll hear from the sister of the healthcare hero who died. Head to our investigation on WSPA.com. Amy Wood, 7 News.